So a lot of times it's a lot of work in the quad,
Mhm.
quad, hip flexor, hips, and glutes. So depending on what I'm seeing from my assessment, right, whether it's, this is maybe more of a hip tightness issue, looking at those like glute weaknesses, are they having glute trigger points that's causing a rotation at their hip, right? All of
Right,
those
right.
things I'm kind of assessing, but a lot of times it's first just getting the quad to relax because 90% of the patients probably that I see um, are, if they have knee pain, their quad is lit up when they come to see me and it is very tight. So
Yeah.
getting that to relax is probably my first thing, whether that's compression, trigger points, we can do some stretching things. Um, and then also just, hitting those other points of the hip or the ankle if I see something with their, analysis that I'm saying like, hey, this might be causing that too.
Yeah,
We might do some joint mobility and such. So
absolutely.
yeah.
All right, like all that. And so again, tons of soft tissue work.
Yep.
You tend to be like stretch space as well too. And
Mm-hmm.
again, just to try to highlight what I perceive as your advantage as a massage therapist is because you have this extensive athletic training, you're really able to kind of tie this into performance, maybe a little better than your average Joe massage therapist and everything,
Yeah.
because you have that experience and that connection and sort of have that understanding of how what we're going to do is globally going to start turning on these performances and these functions, right?
Right, right, definitely. And I think too, my big thing is I educate my patients, right, as I go, which
Yes.
we all try to, I think.
Hmm.
Um, but trying to get them to understand, hey, just because I'm working on this now, right, you have to go home and do the work too. You have homework, right? You
Yeah.
got to go stretch your quads. You have to go fire those glutes, right? You need to, sometimes I'll show them some exercises to go and say, hey, we're going to do X, Y, and Z with the band at the gym
Hmm.
so that you can fire your glutes so that your quads stop taking over and
Uh-huh.
trying to do everything.
Yeah. Yeah.